Big Hits WBTC. Time to get back to talking with the doc this morning. As our Talk with the Doc, Dr. Timothy McKnight, is being brought to you by Mako's Pharmacy at 240 East 3rd Street in downtown New Yorksville. Mako's is your local pharmacy with a caring and knowledgeable staff which is focused on your health and wellness. Good morning. I hope your health and wellness is good.
It's pretty good.
Okay, good. But we do have to talk about when, I guess, things are not so good. And we all have these times when we're experiencing some sort of pain, whether that's a nagging little pain or a sharp pain or however we describe it. But first thing you think of a lot of times is go to the medicine cabinet, right?
Right, and try to decide what to take for that pain.
Yes.
Is what some people struggle with. Interesting to me that a lot of people look for muscle relaxers, and most muscle relaxers are prescription. I don't find that they work as well as we'd like them to. You know, you pull a muscle, you spend all day working in the garden or pulling weeds, and your back hurts, and you think it's tight, and so a muscle relaxer sounds great. But that's more in theory than in practice. I just haven't seen muscle relaxers do what we would like them to do. I mean, maybe for some people, but it really causes your mouth to be dry, makes your vision a little blurry, makes you a little drowsy. I've found my experience has been the best pain reliever over the counter is an anti-inflammatory, an ibuprofen, Advil, Aleve, something like that. A lot of people use acetaminophen or Tylenol, and I really don't think that works great. Now, for some people it does, and it's safe in some respects, but even Tylenol, you have to be careful that you don't take too much because it can cause liver damage. That's the big risk with Tylenol. Most Tylenol tablets or capsules that you take are about 500 milligrams. So the limit there is about 6 of those a day. Now, that's someone who's got a healthy liver that can handle it. But if you've got any liver issues, you have to keep it under that. And in my opinion, Tylenol is good as something for fever. But for a lot of people, it really doesn't do well for just that arthritis, kind of achy bone pain, muscle pain, just the nagging pains that we have every day.
Well, that's what I asked. The difference, what do you need for your back as opposed to your headache? Because that may be a lot different.
Well, yeah, it's a little bit different. Headaches are often treated, especially if they're like a vascular migraine, a typical migraine. The over-the-counter choice is an Excedrin migraine. So it's got a little bit of aspirin and then some caffeine, and caffeine helps to tighten those blood vessels up that dilate. That when those blood vessels in the brain dilate, that causes them to causes the vascular migraines. But at least 50% of migraines are tension migraines, and we've talked to Dr. Jakubowski about that. It's muscular. It's the poor posture for hours at a time. The muscles tighten in the back of the head and in the neck, and they cause this headache, which is really a tension headache. So we're back to what helps muscle pain, probably those anti-inflammatories, the ibuprofen, Motrin, Aleve. But even those, you have to be a little bit careful because the risk with the non-steroidal anti-inflammatories is they can cause stomach ulcers, gastritis, and they can cause kidney problems. So you have to be careful. If you got kidney problems, kidney disease, you really have to monitor the dose. You can't take too much. But for a healthy person with good kidneys, you have an ache and pain after working outside, probably 3 ibuprofen. If you're smaller, maybe 2 ibuprofen. A couple times a day with food. You really have to take it with food because it can irritate your stomach if you don't. So your choices are the non-steroidal anti-inflammatories or Tylenol, acetaminophen. And my recommendation for most people is the non-steroidal anti-inflammatories.
You talked non-steroidal. Is there an over-the-counter with some sort of steroid that you can get, or now are we starting to talk about prescriptions and narcotics?
Prescriptions, because when we use steroids like a prednisone or a methylprednisolone option, those actually work very well for an inflamed back or a bruise on the bone from an injury. They work excellent, very well, and I personally use them when I need them. They're phenomenal. They help you have energy, but if you take them long term, it can suppress the immune system. It can accelerate the development of cataracts and makes your bones weaker. Can cause you to gain weight. So you have to be careful. You can't use those, in my opinion, more than a couple times a year without running the risk of some of the side effects. So then when we're past the ibuprofen for the musculoskeletal pain that we're talking about, the prescriptions. You can use the steroids, and then we're into narcotic kind of pain medicines. Tramadol is sort of in a class by itself. It's not technically a narcotic, but it's for moderate to severe pain. It can be habit forming. You have to be careful with it, but it does work well. And then we're going into things like Norco or Vicodin or Percocet, the codones and hydrocodones, which have a really high risk of habitual use.
Yes.
And there's other side effects. There's constipation and other problems. But for acute pain, like a post-surgical pain, those medications can be very helpful. You just have to be careful that you wean off of those quickly so you don't become dependent. And I learned many years ago that 10% of us have the gene to become addicted to alcohol with that first drink. That's not a high percentage of the population, but that puts some people at high risk to become addicted. And it's that same kind of addiction potential with these narcotic pain medicines. You get a couple of Vicodin for a pulled tooth or wisdom tooth extraction, and boy, you can really become addicted quickly if you have that biochemistry. So we have to be careful with those. And then we go back to, well, what's causing the pain? Today I played basketball and my Achilles tendonitis was really flaring up. Mm-hmm. I haven't taken ibuprofen yet, but I was massaging the calf where the knot is and working on the Achilles tendon to try to work that out. I could jump right into pain medicine, but that's my body saying, hey, this is tight. You've been doing too much. The muscles tighten up. It's pulling on the tendon, and that's where the pain's coming from. So you have to get to the root cause if you can.
Something like that, can you use topical if you're talking about muscles?
Yes. That's a great question, a great point. Capsaicin is a topical cream, and it's an analgesic that some people can use. We can also use lidocaine patches, which are topical numbing medicines, and those don't have the systemic effects. So that's a great option for certain people.
Shaq can do that.
Yeah, Shaq can do it, and but many of us could benefit from some of those topical treatments. They do work well. So it's just. I've just seen people not have results with Tylenol for pain, and then they think they need a prescription. Well, let's figure out the mechanical problem, the root, but try ibuprofen, try Advil or Relieve, and follow the recommendations on the bottle. And if you have questions or you've got a history of bleeding ulcers or a history of kidney disease, check with your provider first. And the other huge caution with these nonsteroidals is you really shouldn't take them if you're on a blood thinner. If you're on Coumadin or Eliquis or something for your heart, for atrial fibrillation or these conditions that require a blood thinner, that combination can really increase your bleeding tendency. So that's a no-no. You don't do that.
And that's information you must pass along, because
Absolutely.
How else will the doctor know that?
Right.
Especially if it's a different doctor.
Yes. And I would say also talk to your pharmacist. Mm-hmm. If you go to the same pharmacy and they know what you're taking, they can look this up on their database and say, hey, you're going to have an interaction here. I've said this before. Our pharmacists are just some of the greatest people on the planet. Very smart, very unassuming, but they can help us so much. We just need to ask them. They can be a tremendous help to all of us.
Let me ask you one more question, somewhat related. We see so many drug commercials on TV, and some of them are 2 minutes long, and they're good for this and that. And then they have the side effects, which always include death, it seems like.
Right.
But how receptive are you to somebody who comes in and goes, I saw this drug on television. I think it might work for me. I guess you have to give it a little consideration, but are you influenced by that very much?
No, I just want to make sure why they think it would work for them, and then I have to think about their condition. Are we fixing the problem, or are we putting a Band-Aid on it? But there are risks. I mean, you watch those commercials and you think, boy, why would I want to why do I put myself at risk, right? But they kind of have to do that legally. Right. When you look, when we go on our databases, or you ask a pharmacist to look at a medication, the most common side effects are listed first. And just remember, when they come up with these side effects, which sounds like, boy, that would be horrific. Why would I want to take that? Well, it might be 1,000 people that are studied for a month while they take this medication. And when they come back at the end of the study period, they have to report any health issues they had. Mm-hmm. A runny nose, a sprained ankle, a cough, a stomach ache, diarrhea, and those all get listed as a potential side effect, when most of these are just life experiences, things that happen to all us randomly. But those that are listed most common, in that list of maybe 40 or 50 questions, those are likely to be related to the medication. So those are the ones that we normally pay attention to. The first 4 or 5 side effects, and you'll see those on the package inserts. But don't get too caught up with the long list and all the potential problems, because it's probably very unlikely. Talk to your pharmacist, talk to your medical provider, and I think you'll feel reassured that you're probably going to be okay with most of these medicines.
So overall, though, those commercials, thumbs up, thumbs down?
Well, I think they're informative. They're designed to sell a product, right?
Yes.
So there's marketing involved, but then they're trying to protect themselves legally, so they have to list all the potential hazards. But I think most people, when we see these, we think, boy, I don't think I want to try that. So, medicine has a role, and, pain medicine in particular, we're really fortunate. We live in an age when we can treat pain effectively. I mean, just imagine breaking a bone or needing surgery 100 years ago when we didn't have some of these pain medications we have. We're so fortunate, and they can really help us, but they need to be used in the right hands for the right conditions, for the right duration, and we need to try to get off of them.
Right. Well, thanks. I think that's a great way to close, and appreciate you coming in here and answering all my questions.
I hope you feel better, Brad.
Thanks a lot. That's another episode of Talk with the Doc this morning here on the BT Morning Show.